Hello, everyone, and welcome to the Down Syndrome Center podcast. As always, I'm your host, Dr. Kishore Velody, and today we have a repeat guest on with us today. Katie Frank is joining us again, and I'm so excited to delve deeper into this topic of sensory processing. For those of you who are longtime listeners of the podcast, last year, 2020, actually 2 years ago now, 2021, we did episode number 109, which you can go back and listen to on sensory processing in general. And so we're not going to go over all of those things again, but today I just wanted to address a listener question regarding some sensory issues, and that's why I reached out to Dr. Frank. Katie, would you mind just sharing a little bit again with our audience about who you are, what you do, and what it is about this population that gets you excited to work with them?
Absolutely. So I am an occupational therapist, and I currently work at the Advocate Medical Group Adult Down Syndrome Center in Park Ridge, Illinois with Dr. Chicoine. I've been here for 7 years. I've been an OT for over 20. And before working with adults with Down syndrome, I actually worked in a pediatric Down syndrome clinic in Cincinnati for 6 years before moving to Chicago to get my PhD.
That's fantastic.
As far as why I love working with this population,
Yeah.
I am a sibling. So I have a younger sister with Down syndrome. She unfortunately is no longer with us, but that is why I do what I do, because of the very short time she was in my life. She was a motivating factor. And so I get to help her peers every day, that's really rewarding. And then it's just a fun place to work. Like, you never know what to expect. It's hard to have a bad day here when you work with individuals with Down syndrome.
That's fantastic. Yes, and the work that you in the clinic do in Chicago is pretty internationally renowned, and so I think hopefully our audience appreciates the fact that you are spending this time with us to share your expertise. So let's just get right into it. I want to address a few listener questions, and actually questions that I get frequently in clinic as well as we go through this. But the one that came specifically from the listener was on sound sensitivity in Down syndrome. We touched on this just a little bit on that last podcast, but giving us an idea, if you have any, of what it is about folks with Down syndrome and why sound sensitivity can be a big issue. So for our audience, just kind of give you a background, I'm thinking like, in a crowd or at a concert or at a baseball game, we'll often see perhaps people with Down syndrome who are affected by that loud noise. Maybe they need to put some sort of headphones on to muffle it or leave that environment. Like, what is it about Down syndrome, do we know, that might make them more sensitive to sound?
Well, I wonder if it's just how they're processing the sound that is coming in. And so, hearing loss is very common in individuals with Down syndrome. So if they have hearing loss and then they're hearing sounds coming in, whether or not they're wearing hearing aids, which could amplify the sounds even more differently, it can just really impact, and it could sound kind of excruciating for them. So again, when we talk about sensory processing, sometimes when there's issues, it's like fireworks going off in our body or ants crawling on our skin. So they might feel that way, but really can't tell us that. The other thing that could impact the way they process sound is earwax. So that's also super common in individuals with Down syndrome. And so it can impact the way that they hear sounds. But what I do find funny is that most of the time we ask and they like their music really loud, but it's other loud sounds they don't like. And when that's the case, it's also usually dogs barking and babies crying. In the gymnasiums, sometimes it can be hard, whether it's the whistles blowing, the echo, the ball bouncing, whatever. But if they're playing the sport, oftentimes it's not as bothersome for them.
So sometimes there can be like a medical cause, but sometimes it can just be something that we see and we don't really know exactly why it is in Down syndrome. I don't think there's any research, right? Am I on the right path here?
I'm not aware of any research. Absolutely. So it's just something that we see it a lot. And again, it could just be that there's some disconnect between the messages coming into their brain and where they're going to their body. And so it's not that there's actually something wrong with, like the nervous system, but there's almost like there's a kink in it and that message just keeps getting stuck there and can't go all the way. So they're just processing things a little differently than the rest of us.
And if somebody was to come to you and mention that this was an issue for them and for their loved one with Down syndrome, what are some techniques that you might suggest to them to help that environment be better tolerated?
Absolutely. So if headphones are not tolerated, sometimes even not necessarily sound reducing headphones, but it could just be headphones with their own music. But just doing some kind of sensory activity beforehand. Perhaps if we can relax their body enough, then those sounds that they hear, they're able to process them better and they can tolerate it. If it's something for a short amount of time, like maybe they just have to walk by the neighbor's dog who's barking, they could, do a first then or do some kind of behavior, even though it's not really a behavior issue, but perhaps knowing that they'll get something really motivating after they, walk by the neighbor's house, or just giving them a big hug. Or some kind of other proprioceptive input, which there's a bunch of information, I'm sure, in that last podcast, as well as in our resource library about proprioceptive input, but easy things, especially when you're already out on a walk, to just help prep the body, because proprioceptive input can help with those easy transitions too.
Fantastic. Oh, and thank you for bringing up that resource library that you have through your center. We all use it in working in the population that we work with. And so I'll definitely put a link to that in the show notes as well. The specific question that we got in this email was really on sound sensitivity, but also specifically tolerating hearing screenings. So as part of the healthcare guidelines, we know that especially young children are expected to get hearing screenings every 6 months. And then as they get older, even into adulthood, at least every year or two. And so the question that came up was, hearing screenings can be a little bit difficult for this person's loved one to tolerate. Are there things that you would recommend for them, maybe specifically in terms of tolerating hearing screenings?
Absolutely. So again, we could do some sensory activity to prep the body, because the other thing that's really interesting, and I believe I mentioned this before, is that in order for our common senses of sight and sound and taste and smell and touch, for us to process those, we have to first be able to process the proprioceptive and vestibular systems. And so we do that through activities. So if we do a sensory activity and prep the body is going to be more open to the other sensations, which then we would provide accommodations for. But if we prep the body, it's good. They might be able to tolerate if it's the sensory aspect of the hearing with it, the wearing the headphones. Using a social story is always really helpful, so that we can let the person know what to expect. You're going to go here, this is what's going to happen. This is how long it's going to take. It's not going to hurt. This is what you're expected to do. Perhaps even just a first we get a hearing screen, then you can, get your tablet or whatever it might be. Maybe practicing wearing headphones at home beforehand so that they know. I know we talk about this with CPAP a lot. If there's an opportunity to go and practice, kind of like you can do a PAP with the CPAP, maybe go and just sit and practice without actually having the hearing exam, but being in that room, kind of getting the tour, sitting there wearing the headphone, but without actually doing the test could be helpful.
So another area that people ask about in terms of sensory type things are some of the more activities of daily living, or ADLs as we call it. Something like toothbrushing. We find a lot of oral sensitivities many times in our patients, and toothbrushing being often one of the least liked part of the daily routines for people with Down syndrome. What are some techniques that you might suggest to help with toothbrushing?
So sometimes if you're using just a regular toothbrush, using, even for adults, that child size brush, like having the smallest head on the toothbrush, just because the mouths of individuals are so small, but often using battery powered or electric toothbrushes is helpful, just because they might actually enjoy that vibration, that sensory input, and it makes brushing teeth more tolerable. And then you want to kind of use a desensitization approach oftentimes, where you work first on just tapping, let's just tap your teeth, or let's tap your tongue, without toothpaste on it. And then, it's just like a wet toothbrush, and you just work on then brushing a few times. And I've used visual supports with it. We're going to do each side 5 times, and we count to 5, and then we move on. And then you eventually then get, toothpaste, and you go back to the beginning, and then you do toothpaste with, on the brush with the brushing. And then eventually, with a lot of practice, they might do it also providing hand over hand assistance. So they still have a little bit of control, but you're helping them. You're going to help with thoroughness. Sometimes playing songs, so they know that if it's their favorite song and we listen to it, and we have to brush our teeth during that song, and when the song's over, toothbrushing is over.
Yeah.
Strategies like that tend to help.
Yeah, and I don't know if you've seen these. I had a family just very recently point out to me on one of the online shopping network sites a three-headed toothbrush. So it had a regular toothbrush, and then it had two more on an angle, so it would get the front and the back of the teeth at the same time, kind of maybe limiting the amount of time that they needed to do the toothbrushing. I found that to be something that I've been recommending to some families recently as well. How about this? So another family was asking about like sensitivity, like on the head, especially like with things like hair brushing or haircuts and things like that. And I do recall, even as when my brother was younger, that going to the barber was not a very pleasant experience. I developed a lot of sound sensitivity because of the screaming out he was doing at that age for getting his hair cut. So what are some techniques that might work in that area as well?
So again, using that sensory strategies to help prep the body. For hair brushing, you can also consider the type of brush you're using and look at the bristles. So some people don't like the plastic bristles and they prefer those firmer bristles, but oftentimes those firmer bristles naturally hurt the hair or the head. And so you want to then use the plastic bristles. If it's more of they have tangles in their hair, really thinking more about when you're bathing, making sure you're using a conditioner or detangler and using a comb with the wet hair in the shower to try to get the tangles out before you're even drying the hair. And then with haircuts, if they tolerate weight, having, if you can use like an X-ray vest or the weighted vest underneath the apron, again, to give them sensory input during the activity, using a social story, first then, reward system. There's also some scissors that are available on Amazon that act like a clipper, but they're the scissors. So if it's the sound of the clipper, like the buzzing sound or whatever that they don't like, or they don't like the feeling of that buzz, then it's an adaptation on the scissors that will more clip instead of just snip. But sometimes it's the sound of the scissors.
Yes, right.
And so then you need the buzzer and you might be buzzing other people's hair. But yeah, there's definitely some other tools out there, but I think again, it's prepping that body, making sure they're calm. You can always use distraction. I mean, maybe sitting there watching their favorite video on the tablet is enough to get them to tolerate it.
Doing that visual distraction. You mentioned the weighted vest, which is interesting. Is that something that is able to be purchased online, or do you need a prescription from a doctor? Like, is a weighted vest something easy to find?
I mean, it is.
Yeah.
Unfortunately, in a lot of the catalogs, they're expensive. So there are some weighted blanket and lap pad options on Amazon.
Mm-hmm.
You can also easily make them, but if your dentist still uses the lead X-ray vest, there's a time when they aren't like effective anymore, valid anymore, and they have to get rid of them. Yeah. So I sometimes ask families to talk to their dentist and see if they can use that, or if they have access to any other lab that has different lead vests that they can use and try. Right. But again, when it comes to weighted products, we do 7 to 10% of someone's body weight, no more. You can always do less if that works best. And then the other thing about any kind of sensory activity that we do is that we really only need to use these strategies for no more than 20 minutes, because after that, our body just tunes it out. So if you think about if you wear reading glasses and then you put them on the top of your head, and then an hour later, you're like, oh my gosh, where are my reading glasses? Your body realized that the reading glasses were not causing harm or pain to your head. And so your body just tunes it out. And that's the same with any kind of sensory input we would use. So it wouldn't be like they would have to wear the weighted vest or anything weighted all day. It would just be for that activity. The other thing that can be helpful sometimes if they like that feeling is Under Armour clothing or any kind of other Lycra clothing that might naturally kind of feel like compression. And so they could wear that maybe under their clothes just for an activity like brushing their hair or haircuts, or even getting their hearing tested. Yeah.
Awesome. Okay. And one other one, and then we'll end this podcast for today. I'm sure there's other sensory things that families are thinking right now that they want to send me for a future podcast with you. But Nail cutting. Nail cutting is an area on the hands or on the feet that are often, families will tell me they hate it so much that they try to do these things after the child has gone to bed and things like that. What are some techniques that you have found to be helpful to make tolerating nail clipping a little bit easier?
So the first thing is you want to make sure that the nails are wet. So you soak them first. It just makes it easier to cut. So if there's some kind of discomfort that they don't like about the nail cutting, just being wet makes it easier. There's also some automatic nail clippers now. I saw them on Amazon. We have one here that's, I forget what it's called, but it's just like a box, and you put your nail in and then it automatically cuts it for you. And then you just pull it out, and it does just a little bit at a time. It's not, I don't think it's for feet. And especially because our friends with Down syndrome tend to have toenail fungus and things like that make their toenails a little bit harder to cut. So with that, we either see a podiatrist, or if they like getting pedicures, oftentimes that's the way that I know a lot of the people I see end up getting their toenails cut, or even their fingernails cut, is going to have manicures and pedicures.
Yeah. Wow, thank you so much. This has been really helpful. I think, we touched on so many of the sensory things. I would direct our audience to some of our prior behavioral stuff, in case there's a behavioral component to why they may not appreciate some of these things too, like trying to prepare, like we were talking about today. Social stories, I think, are extremely helpful. We talked about in the past on some of the prior podcasts about pairing an undesired sensation with something that's desired. So, the reward or the if then type of system can be really helpful in that. I always say, as the sibling, and that was often the one used in this role, is praising the sibling for doing the desired behavior, not in a negative way towards the person with Down syndrome, but more saying, hey, these rewards are available for you too. And that can be sometimes helpful. One nail, you get this; two nails, you get this, and those things can gradually help somebody tolerate these things as well. But boy, we went over a lot of different topics today. Is there anything else, Dr. Frank, anything else that you would want to make sure that our audience knows, or big points that you want to make sure that you share before we close the podcast today?
Well, we all have sensory processing difficulties. Some are more apparent than others. And so while it can be quite frustrating sometimes to deal with them, know that we can all get through them. But sensory processing grows and changes with us as we age. And so if there were strategies that you previously